SDG 3 focuses on ensuring healthy lives and promoting well-being for all individuals despite their age or socioeconomic background. Article 25 of the United Nations Declaration of Human Rights clearly states that medical care is a right for everyone, and more than half of the world's countries have included the right to health in their constitutions. Nevertheless, according to the World Health Organization, half of the world's population does not have access to the full coverage of crucial health services. People living in LEDCs are still suffering from preventable diseases, and many are dying prematurely. This can be solved if people living in impoverished areas have access to timely, appropriate, and affordable vaccines, medicines, and other health services. Providing healthcare for residents of LEDCs is vital, since this will prompt them to overcome other barriers they face in life. Having accessible hospitals, clinics, and other medical services will increase an LEDC's average life expectancy, Human Development Index, and will also decrease child mortality rates. Therefore, having convenient healthcare will improve the development of a nation. Not obtaining efficient medical services can mean the difference between life and death. When underprivileged citizens receive affordable healthcare, they will be able to send their children to school or even invest in their own business. Health transforms the nation and the economy. Every $1 spent in health can generate $9 to $20 in full income growth by 2035. Furthermore, health improvements resulted in a quarter of full income growth in developing countries between the years of 2000 and 2011. Currently, 1 billion people around the world lack basic health care. Many factors influence the unattainability of quality health care. Some social causes at the root of this issue include education, gender, profession, income, ethnicity, and place of residence. Additionally, 1/3 of all households in Southeast Asia and Africa have to borrow money or sell valuables in order to pay for health care. Several other elements which lead to the downfall of healthcare systems in the developing world are the absence of or shortage of skilled manpower, essential equipment, drugs, and supplies in health facilities, which need to satisfy the necessities of the population they serve. As a matter of fact, data collected from 2005 to 2016 indicates that almost 90% of the least developed countries' LDCs have less than one physician per 1,000 people, and over 60% have fewer than 3 nurses or midwives per 1,000 people. These shortages of trained professionals has caused an overwhelming amount of preventable deaths to occur. According to the World Health Organization, every day in 2016, 15,000 children died before their 5th birthday. In fact, 50% of children under the age of 5 who die of pneumonia, diarrhea, measles, HIV, tuberculosis, and malaria are in Africa. Furthermore, approximately 1.6 million Africans died of malaria, tuberculosis, and HIV-related illnesses in 2015. Poverty-stricken residents of low-income countries suffer from high rates of diseases, especially contagious illnesses. These people have to survive with limited food, dirty water, and a very low level of sanitation. They live in conditions where disease-causing organisms thrive. The leading cause of death in developing countries, specifically those in sub-Saharan Africa, are infectious diseases, the most common of which are HIV and AIDS, lung infection, diarrheal diseases, and malaria. HIV is a virus which can be caused by the sharing of each other's sanitary products and leads to an advanced stage of infection called AIDS. The easiest way to prevent HIV is to raise awareness and counter people's misconceptions about the illness. The most common lung infections include tuberculosis and pneumonia. Pneumonia can be caused by multiple organisms which include bacteria, viruses, and fungi. Some symptoms of the disease are coughing, fever, loss of appetite, and a rapid heartbeat. The elderly, very young children, and infants can easily develop this disease. Treating mild pneumonia is quite easy. It can usually be treated at home through antibiotics and drinking lots of fluids and getting plenty of rest. Assuring good standards of hygiene will help stop germ spreading. It's as simple as washing your hands regularly and throwing away used tissues. Yet, a lot of people in LEDCs aren't aware of this and still live in contaminated conditions. One of the largest viral infections which causes child deaths is measles. It is highly contagious and causes severe fever and red rashes. In 2017, measles took the lives of 110,000 people, who were mostly kids under the age of 5. Unvaccinated children living in LEDCs are at a very high risk of this illness. Measles can be easily prevented through routine vaccinations and immunization campaigns. According to UNICEF, 12.9 million infants were not immunized in 2016. Children living in the developing world may not receive vaccinations due to the fact that vaccines may not be available, or because families are ignorant or misinformed about when and why to immunize their child. Educating parents on the importance of vaccines is vital for measles prevention. Providing all children with vaccines is crucial to improve healthcare in LEDCs. Poverty and inaccessible healthcare are strongly linked to each other. Out-of-pocket payments for healthcare prevent impoverished citizens from using services. When healthcare is needed but is delayed or not obtained, people's health worsens, which in turn leads to lost income and higher healthcare costs, both of which contribute to poverty. The relationship between poverty and access to healthcare can be seen as part of a larger cycle where poverty leads to bad health and bad health maintains poverty. In 2010, almost 100 million people were pushed into extreme poverty because they had to pay for healthcare services by themselves with no NGO or government funding. The urgent issue of inaccessible healthcare in LEDCs needs to be solved, since it currently affects millions of lives from minors under the age of 5 to senior citizens above the age of 70. We need to start treating healthcare as a right and not a privilege. So delegates, how can we combat this ongoing problem together?